Good evening. Let me share to you the week 10 for nursing research, and we will talk about measurement. Okay, so for tonight we'll have statistics. Okay, let me share my screen. Okay, for a moment, it's not working. Okay, okay, so we have here measurement. Measurement is based on rules. Okay, often measurement is about assigning numbers or some other classification to subjects in a way that represents the quantity of the attribute numerically. So again, when we think of measurement, that concept often begins to mind equipment or tools applied to some concrete physical manifestation or anything that we could measure. Okay, indeed, measures used for sciences involve very strict rules about assigning numbers to characteristics, um, or in a completely unbiased way. So not all measurement though is quite so straightforward. There are times that the measurement that we are using could have some error. Okay, so we have here whether are the data collected by calculation of a value or by classification into groups, they will likely be represented by a number. Okay, so you think that numbers are key of measurement in nursing for several reasons. And even though nurses doesn't like numbers, but again, we deal with research. Okay, so we deal with statistics or numbers, and numbers are objective and they are often standardized so that they could be consistent. But numbers could serve as a universal language and as means of communication in an increasingly global world. Okay? A statistical test also could be applied to numbers, resulting in quantification of how much error a measure represents. Okay, numbers are precise and can accurately represent attributes. So numbers are a key element of measurement and they should be objective, they are standard, they are consistent, they are precise, they are statistically testable, of course, and they are accurate representation of attributes. And of course, regardless of the type of measure, numbers are useful only to the extent that they represent the underlying characteristic they are intended to represent. Okay? To have value, they must be clearly linked to, of course, research question, your SOP, your hypotheses, and appropriate to represent the variable of interest, and they should be, again, consistently accurate. Okay, we have here the measurement strategy. So it should be a thoughtful determination of the most relevant attributes that demonstrate the answer to the research question. Okay, the actual measure of an attribute is only one part of a measurement strategy, and the complete measurement strategy is critical, of course, to the design of a valid research study. When we say valid research study, it is done with consistency. Okay, so both time and energy should be applied to planning and execution of this one. So number two, you have to define the attributes or variables um, in terms of the operations used to demonstrate them. So you have to define these variables or attributes based on how you will utilize this in your study. Selection of an instrument that will reliability capture an accurate representation of the attribute. So it is very important for you to select the instrument here or your questionnaire. It should again answer the problems that you have stated in your statement of the problem. And number four, you have documentation that the instrument and the measurement procedure are reliable and valid. So there are times that when your questionnaire is modified or self-made, it should undergo validity and reliability. And number five, you have to development of protocols to guide the process of gathering data. So how would you do your data gathering? And that should be stated in your data gathering tools and procedure. And number six, quality checks to ensure that the data collection process results in an accurate and complete data set. Okay, so you have here the definition of variables. Of course, the first step of measurement strategy is to give a careful thought to the concept represented in the research question. Okay? The research question will describe the phenomena or characteristic in a study. which then must be translated to observable attributes or numbers, or something that could be measured. Eventually, these concepts may be represented by physical attribute, like, for example, your blood sugar, perception, like, for example, pain, behavior, okay? Like, for example, the way that the patient walks, or a response, like recall, okay? So we have here what we call as two kinds of definitions in um, for attributes or for variables. We have here conceptual definition. When we say conceptual definition, it describes the concept that is the foundation of the variable by using their concepts. For example, um, a conceptual definition of depression might include the presence of, for example, sadness, lack of pleasure, ano ba, and changes in eating or sleep habits. Okay, so an operational definition, on the other hand, defines the operations that must be performed to accurately represent the concept. So this is, of course, useful to begin the process of defining the research. When you say operational definition of terms, you should be defining these terms on how you will be using these terms in your study, or how these variables will be utilized in your study. Okay. Okay, so if you're to represent underlying characteristic, numbers used in research measurements must be, of course, clearly linked to the research question. Okay, it must be clearly linked to the research question. Again, your statistical measurements should answer your research questions on what are the research questions stated in your statement of the problem. Okay, and then we have here appropriate to represent the variable of interest, and it should be consistently accurate. Okay. Next is you have to determine a measurement. Okay? In determining a measurement, okay, of course, after writing an operational definition, the researcher defines the procedure for collecting and recording data. Actually, measurements may be either primary or secondary, and primary are, of course, these are your calibrated instruments, like, for example, thermometers, equipment like your digital camera, test questionnaires, or rating scales. You have your observations, or you can count the number of balls in a unit. Okay, so primary data are considered, of course, the most reliable. Okay, because the data that are collected by the researcher for a single specific purpose, but they do have some limitations. Okay, primary data are time consuming to collect, and the quality of the data depends on so many factors. Okay, so again, as you as a researcher, as a data collector, could also affect the accuracy of the primary data. For example, the data collector or the researcher may use equipment or measurement incorrectly. So, for example, the equipment is not calibrated. Okay, so I will give examples later. And this one. So effective data collection must be designed to be clear, it should be unbiased, it should be reliable, it should be valid, it should answer the research question. My dear students, okay, you are a nursing student, you are conducting a research that would possibly refine nursing practice, or for us to better our clinical decision in the area. So it is a must for us to do our best, okay, to do our best to give definitive results in our quantitative research. So we will not be giving a false recommendation for policy construction purposes in the hospital, or even in the community, or anything that could be made after the research. Okay, we should be doing something that could help, again, refine nursing practice. Okay. We have what we call as physiologic measurement. Okay, so again, if we have to go back, evidence-based practice focuses attention on the physiologic measurements from patients for, of course, clinical research efforts. And physiologic measurement involves the assessment of or assignment of a number or value to an individual's biological functioning. Like, for example, you have, it could be, again, as stated here, it could be self-reported, it could be directly measured, it could be indirectly measured, like, for example, your vital signs, or lab results or urine outputs, and these are all positivist, okay? In the positivist perspective, because these are things that you could see. Again, you have physiologic measurement, could be self-reported, like, for example, your pain, your dizziness. Okay, these variables are often critical part of research, but they are subjective in nature. so that their measurement is depending on the participants' understanding of what is being asked from them or of them. Okay, and of course, this time, such data are usually collected using instruments but of a different nature than the ones used for measuring biological functioning specifically. For example, this one is being measured by psychometric instrumentation. So when we say psychometric instrumentation, it is applied to measure subjective or conceptual information. Examples are self-concept, stress coping, self-esteem, motivation, and similar psychosocial elements. Okay, many instruments exist that have determined the reliability in measuring subjective characteristics. So we have to find an acceptable instrument, and this is critical to a strong measurement strategy. So before a researcher begins to develop their own data collection tool, a literature review is justified or made to see whether there is an existing instrument that might be applied to answer the research question. If one does, you have to obtain permission, and that is what we call you are adopting the questionnaire. You have to obtain permission from the ones who made the questionnaire that you will be using their questionnaire for your research. So there are many advantages of using an existing instrument rather than developing a new one. Okay. Okay. Aside from that, um, it's time saving. Okay. Um, because when you will be making your own questionnaire, the researcher might need to validate the questionnaire or the instrument. Okay, so you will have to, of course, you have your test blueprint, you have to create question, you have to solicit feedback about the fidelity of the instrument to the blueprint. You have to pilot test, ano pa yung gagawin mo, you have to make revisions, and this process could be burdensome. Okay, it could actually delay your research and should be undertaken only when a thorough review of the literature reveals that there are no acceptable existing instrument, and that is the time for you to be making your instrument. Okay, so next is you have what you call as, I think, surveys and questionnaires. Okay, the most used data collection method is the survey. In the survey method, a systematic tool is used to gather information directly from respondents about their experiences, of course, their behaviors, their attitudes, and perception. It could be depending, of course, on the type of question that is used. Survey research can rely to a quantitative design, a qualitative design, or a mixed design. Okay, surveys could be personally distributed or through mail or delivered online, and they could be also administered during a face-to-face interview or a telephone survey. So we have open-ended and closed questions, and this open-ended refers to interviews, and of course your closed question refers to your questionnaire. So we also have what we call as forced choice questions. When we say forced choice questions, this provide choices that are mutually exclusive and encompass the total range of answers. And these kinds of questions are used when the researcher wants the respondents to choose the best possible answer among all, of course, the options presented. For example, um, of course, in this one, in first choice question, there is no wrong or right answer. For example, when measuring the amount of knowledge of a diabetic patient, okay, after doing your, for example, health teaching, okay. Number two is you have, or letter B, or you have your dichotomous question that could be answered by selecting from only one of the two choices. And these types of questions typically are used to determine the characteristic that is present or if respondent belong to a particular group. Okay? Dichotomous questions yielded limited information about the respondent, and it's difficult, of course, to analyze because in dichotomous questions, um, a limited range of tests are available for the analysis and should be limited to those situations in which no other type of question is appropriate. So you also have here scales. Okay, your scales are example, your Likert scale. Okay, scales are asking the respondents to rank, okay, from 1 to 3 for 5, from, for example, strongly disagree for number 1, number 2 is disagree, 3 is neither agree or disagree, and 4 is agree, and number 5 is strongly agree. And that is an example of scale. So we also have types of scales. We have your Likert scale that is frequently used, and we also have what we call as the Gottman scale. So it depends on what will the researcher use in this one. We also have a visual analog scale. So we have again Likert scale, the Gottman scale, Guttman, and we have your visual analog scale. So depende if what will be the what is the type of scale that the researcher will utilize in the study. Okay. Next is okay, let's start moving. This is an example actually of I'm sorry. This is an example of the Likert scale, the Gottman scale. Okay. Yan. And the first question, the first choice question example, what is your current marital status? You have to select one: single, married, divorced, separated, and or widowed. If your dichotomous question, you only have two choices, male or female, and the Likert scale is 1 to 5, and the Gottman scale, or you have 8 items here and just have to choose yes or no. So that's the Gottman scale, yes or no. So we have here strategies to minimize measurement error. Again, measurement error is the amount of difference between the actual attribute or the true score and the observed score. So measurement error is present in every instrument to some degree or another, and it may be either random or systematic. When we say random error, it's non-reproducible, and when we say systematic error, examples are, for example, when the tape measure is being stretched when you're measuring something, for example, the length of a child born or a newborn, okay, after delivery, and the tape measure that you're using is stretched, and so that in that moment, okay, um, measures could be consistent but inaccurate. So this one, although of course it may, although the tape measure could record the length consistently, the tape measure will routinely overestimate the length kasi it is stretched. Okay. Another one is your dropout correspondence and measures that reflect sensitive or socially taboo topics. For this one, the subject may be able but unwilling to respond, and missing data may affect the results. For example, self-reports of tobacco and alcohol abuse often underrepresented the prevalence of these behaviors in the population. So variability in this moment could be due to anything other than change in the underlying attribute that represents the error. So you have to minimize a measurement error. Okay. Strategies: you have to use properly calibrated equipment and instrument. So, for example, when you are having an assessment of the blood pressure of Nalipara, okay, you have to make it sure that all the blood pressure or the BP that you are using are calibrated. Okay? And of course, it should this number two, ensure reliability and a focus on consistency. So as you see, accuracy and precision. When you say accurate, you're hitting the center of the circle, and when you say high precision, at least you are hitting one. I mean the degree of reproducibility of the generation of consistent values every time an instrument is used. So as you see, in high precision, it hit the black line. Okay, it's under the circle. When you say accurate, okay, when you say accurate, at least it is near the it is nearly objective. Okay, verifying again the instrument is measuring the characteristic accurately. Okay. Yeah, also have here the stability with an instrument. It is called your internal validity, and sometimes we are using here the Cronbach's alpha. Okay, so this one, an instrument must be consistent, and it should be, of course, precise, and it should measure consistently. It should not be measuring the wrong thing. Okay, for example, it is difficult to measure the length of a neonate, as what I'm telling you a while ago. A squirming baby is measured from the tip of the heel to the crown of the head, which is not exactly the precise description, or again, maybe the tape measure that you are using is stretched. Okay, so another one, so you are using the Cronbach's alpha. Okay, the Cronbach's alpha represents the extent to which the variability of individual items represent the variability in an overall instrument. So again, this should be 0.7 or greater for us to accept, okay, that the instrument or the questionnaire is valid. So we have here the coefficient of Cronbach's alpha. We have here when it's 0.9 is excellent, it's 0.8 to 0.89 or 0.80 to 0.89 it's good, 0.70 to 0.79 is acceptable. So again, our or the coefficient that is accepted here is 0.7 and above. So if it's 0.6 to 0.69, it's questionable. And 0.5 to 0.59, that is already poor, and less than 0.59 is unacceptable. So we also have here what we call stability among individuals. So when we say stability among individuals, it is measured by an item total, and this is the total correlation. Okay, this is what we call as the total correlation, and the value should be close to 0.5. So again, these things are determined by your statistician. You must be working with them in the conduct of the study. Next is we have here the stability over time. So when we say stability over time, quantified by a test correlation coefficient, and it's accomplished by, of course, giving the instrument this time, and then you're waiting for another time, and you're re-administering the instrument for us to see the stability of the instrument over a time. Okay, how will you ensure the validity? Okay, so you have here the focus on accuracy and truth. Okay, the search for a valid measure begins by determining all the most important aspects of a phenomenon under study. For example, a study of quality of life in hospice patients. That might include instruments to measure physical symptoms, ano pa yung mga i-measure natin, the social support, spirituality, and mental state na napakahirap, right? It's very difficult. Such study might require multiple instruments to confidentially measure all the concepts related to research question, and each instrument must be, of course, valid and reliable. When we say validity, this is more actually it's more challenging than reliability. Okay, complicating this process is the need to test validity on multiple populations to determine who it is valid for and under which conditions. Yun. Pwedeng yung conditions kasi magkakaiba. Consider, for example, the pain scale. Okay, the pain scale shows 6 phases with the lowest end being a smile, and the upper end, di ba, with a frown face. Okay, the instrument is intended to represent the quantity, of course, of the pain being reported by your patient or by pediatric patient. Okay, for example, is the instrument interpreted the same way by children and by adults? So, for example, yung masakit ba sa adult, masakit din sa bata. So, yun. So, in testing the validity of the instrument, you have to have the test blueprint. Okay, the test blueprint should be, of course, seen by the one who will validate the questionnaire. Okay, so we have here, actually, in this one, a researcher can use several methods to document validity. One of the types may be used in the same study, for example, content validity. Content validity is involving subjective judgment whether a measurement makes sense. So this is what we call as your face validity. Okay, it is a very helpful tool in determining, or the test blueprint, for example, is very helpful in determining the content validity. Yun kasi, the test blueprint can help the researcher determine if the items in the instrument represent all the basic content that must be represented. So you should know what are the things that you are measuring. Often the test blueprint and the instrument are reviewed by pwedeng impartial reviewer na pwedeng i-evaluate niya yung items in the blueprint that are reflected or contained in the instrument. You also have here what we call as construct validity. It indicates that the measurement captures the hypothetical basis for the variable. Again, this type of variability is very abstract, or validity is very abstract. It's very difficult to confirm, but it is very valuable. Why? Construct validity may be the most important type of validity test to ensure that the results will be representing the reality. Okay. Researchers can take years to validate the constructs represented by an instrument. Yun lang, medyo matagal. A common method of construct validation is factor analysis. In factor analysis, the groups or items within the instrument according to their shared variability, or pwedeng the researcher can review the factor groups and determine whether they represent the conceptual basis of the instrument. So it will be a long time for the researcher to do this one. Another one is you have your criterion related validity. So this one, criterion related validity is the correlation of the instrument to some extent of manifestation of the same characteristic. Yun yung sinabi ko dyan, comparison of the old and the new instrument. So most validity tests use correlation coefficient to represent the degree of relationship between the instrument and the reference. Unlike reliability, for which the value of 0.7 is considered the cutoff for acceptability, yun yung sinabi ko sa inyo, and the highest is 9, di ba? It is uncommon for a validity coefficient to be greater than 5.5. Okay, so it's very difficult to get the 0.5. So sometimes actually the instrument is not really valid. And this outcome may occur for a number of reasons, including inadequate sample size or attenuation due to reliability errors. Okay, so we also have here the last one, the sensitivity, or the last two, sensitivity and or specificity. So when we say sensitivity, it is a measurement of discriminant validity to detect the if the disease is present. And when you want to know the absence of that disease, it's a specificity. So when you want to check the presence of the disease, it's sensitivity. And when you want to know, when you want to determine that the disease is not present, that is specificity. And another one, the last one, is responsiveness. Okay, a measure that indicates the change in the subject's condition when intervention is effective. So, of course, when the outcome measure is intended to capture the effect of an intervention, the capability to detect changes in the subject over time is very, very critical, like responsiveness. There are multiple ways to measure responsiveness. Kasama dito yung Cohen's kappa. Okay, hindi nyo na nakita yon. Ibabalik ko lang. Okay, hindi nyo na nakita yung kappa. Or, ayan. We have missed this slide. I'm sorry. Stability between the raters, you have your Cohen's kappa. Okay, aside from your stability among individuals, you have your stability between raters documented as inter-rater reliability. So this type of reliability assessment is indicated when multiple raters observed a record a variable, okay, and record a variable. So this is you have to be there should be a very consistent rating from across raters. So what we call it is your kappa is statistic or percentage agreement. So if there is no agreement between the raters, it's 0. And when there is perfect agreement, it's 1. So we call it as your p-value, your kappa, statistic, or Cohen's kappa. So that is all for tonight. I hope you are loving research. Okay, so this is more of the statistical part, and at least you have noted, tandaan mo man lang that p-value is generated by kappa is statistic or the Cohen's kappa. Again, 0, no agreement, and 1 is a perfect agreement. Thank you for tonight. I'll see you soon for the next topic. Thank you.